And welcome to House Calls, Real Docs, Real Talk. I'm your host, Mercedes Fuller, and today we're dishing up some helpful tips about how to navigate the stress of the holidays. Thanksgiving is just a few days away, and I personally can't wait. I look forward to all of the amazing food, the turkey, the ham, all that good stuff, the football, and mostly I look forward to gathering with my friends and family. But not everyone is able to gather, especially these last few years. For many, the holidays are lonely and stressful. Let's see if we can address these concerns today. With me this morning is our friend, Dr. Camilla Sasson, Vice President of Healthcare Business Solutions, Science, and Innovation for the American Heart Association. Dr. Sasson, my friend, so good to see you.
Good morning. So good to see you too.
Absolutely. So I just have one question, and this is totally off script. Are you doing a lot of cooking for the holidays?
Oh, heck no. I will be the first person to tell you, Mama should not be in the kitchen. So yeah, no, I will be enlisting the help of very great family and also probably some pre-made turkey. I'm not afraid to say that.
Right. That makes two of us
It's all
because
good.
you already know I'm not doing the cooking this year. So uh, I'm excited to dive into this topic to help people in some other ways, especially because we can't give out recipes. Let's jump into today's discussion with health in the headlines. Good health is always newsworthy, so each week we select one current headline that ties back to the topic at hand, and then we ask our expert to respond. This week's entry comes to us from the Boston Globe. The title of this article is Rapid Tests Can Make It Easier to Gather Safely for the Holidays. Now, Dr. Sasson, I read this article, and I have a few questions. Do you feel comfortable recommending the rapid test?
Well, I think the rapid tests are really an important strategy for us to be able to start safely congregating again. And so, I've been following the rapid testing process really for the last year and a half, and it's nice to finally start to see some headway. I know President Biden has really allocated more funding now to make more rapid tests available, and I think that's going to be hugely important. Right now, it's a little bit hard to find them, and they're kind of expensive. I mean, rapid tests are a two pack is about $25 almost. And so again, I always think about, how important it is not only to make them accessible, but affordable and to make them available for people to have all the time. So, I think the rapid test is great. What it does is it gives you a snapshot in time and says, hey, look, do you have enough viral load in your nostril to potentially spread COVID-19 to others? So it's a snapshot. It's not going to tell you, will you develop symptoms in 5 days from now? But it will tell you at that given moment, how safe am I to be in a setting with other people?
Wow, wow. And I thank you so much for breaking down what the rapid test does because there's been so much misinformation out there about it. So thank you for making that clear for us. And I'm so excited to dive into further dialogue with you today because I believe that we're going to help so many people out by answering some of these questions because we can't give out recipes because we're not cooking this year. So let's jump into our main segment to answer live viewer questions. We call this segment You Ask, We Answer. Because we know you love answering questions, Dr. Sasson,
Mhm.
we have so many questions for you in the queue today. Our first question comes to us from Thurston in Beverly Hills. He says this: last holiday season, they were recommending that we meet in small groups or not at all to combat the spread of COVID. But now it seems like a lot of those guidelines have gone out of the window. Is it really safe to see our extended families or hold social gatherings?
Really good question, Thurston. And I think this is where the guidance is hard, right? Right now, it's do this, but don't do this. And so I think, again, this is all about balancing risk and being able to balance that risk with the potential benefit. So, I think vaccines are going to be a really important part of our strategy for getting together this Thanksgiving holiday and even Christmas. So, I think the first question I would ask is if you are going to someone's house or if you are going to invite people over, are they vaccinated? Have they gotten their booster if they're in a high risk group like 65 and up or have a weak immune system? So I think that's the first question I would ask. The second question would be, hey, look, is there a possibility to do this outdoors? We know that outdoors is going to reduce the level of virus that can potentially really happen, get higher in terms of being in a closed space. So if you're outdoors, you're less likely to transmit the virus. You're less likely to get the virus as well too. So if you have the option to eat outdoors, for example, that's going to be a really good option. If you don't, and it's going to be cold out, which, I live in Colorado, it's very likely that it could be cold. It could be 70, it could be snowing, who knows? But, opening the windows and getting really good airflow in those closed spaces is going to be really important as well. And then I think the third thing is really knowing who's coming. So, I, again, right now being cautious because I have a 5 and a 6-year-old who just got their first shot a few days ago. They're not fully immunized yet. So I'm going to have a very small gathering with people that I know who have been really kind of close by with me. I know where they've been. I know that they haven't been exposed. We're going to rapid test before they come to dinner. And those are the things that we're going to do to try to keep our family safe.
Doctor, and I believe that those measures will help us create kind of like that stress-free environment, take some of the stress off of us because we're so concerned about our loved ones. And speaking of stress-free gatherings, here's a question from Ellie in Willing, West Virginia, and this is what she wants to know. How do I create a stress-free gathering for family and friends who might not have similar views or beliefs?
Well, for me, it's going to be don't cook. So I'll put that out there. Make sure everybody brings something. Make it a potluck. That's going to help me be a little less stress free. I will say so. No, but all things seriously. I think it's important to be very honest with the folks that are coming to your home. So that's not just the people you're inviting, but also just letting them know who else is going to be there as well, and giving them that sense of, look, I've thought about who's coming. I know this, this, and this about them. If you feel comfortable coming, that's great. If you don't, that's okay too. I think it's really important to give people the option right now to say, look, maybe not this year, maybe next year. And then giving them options like, hey, let's do a Zoom call afterwards, right? And that way you still get to see the kids, even if you don't necessarily feel comfortable coming over for Thanksgiving dinner. I think that's where it's going to be that balance of both the physical side of what we're doing to keep our family members safe and our friends safe. And then there's that mental, emotional side too, which is still we want to feel connected to people and we want to still have that ability to talk to them, to congregate with them, to, hold them, if you will, like give them hugs and things like that. So again, it's going to be a balance this year. It's not going to be what it was 5 years ago pre-COVID, but I think we're starting to slowly see things begin to feel a little less chaotic and probably a little bit more towards our new norm.
Absolutely. Here's a question from Jane out in Arizona. There is so much to do during the holiday season. How can I keep from stressing out over my long to-do list?
Well, for me personally, I know I've got, I'm an ER doctor. I work with the Heart Association. I've got 2 kids. Having people over. I think the first thing is always to keep things in perspective. That's probably the most important thing, right? Like you don't have to have everything be perfect. I've learned that the hard way. I think people stress out a lot because they want dinner to be perfect. They want the house to be, super clean. They want their kids to look sparkling and shiny. And I think at some point you have to be comfortable with the idea that it's okay to just get by. Because I think a lot of us have just gotten by for the last year and a half, honestly. So, I think taking that level of stress down, hopefully a little bit, knowing that no one's going to judge you, no one's going to care. They're just wanting to be there with you. And that's the most important thing. And then I think also just using your other stress relievers, right? So for me personally, exercise is a really big part of stress relief for me. So getting outside, getting fresh air. So going for a walk, taking a 10-minute walk during lunch, making sure I get my run or my bike, my Peloton bike in that day. So I'm not going to be stressed out later on. And then making sure that you're eating and drinking appropriately, right? So what that means is we know Thanksgiving is going to be a big meal, right? So what we can do to kind of make sure that we're, eating a little bit healthier leading up to it, if we know we're going to have a big meal on Thanksgiving, drinking lots of water to make sure that we're well hydrated. If we're going to, let's say, partake in some libations like alcohol, for example, those are all the things that we can do to set ourselves up for success, not only on Thanksgiving Day, but really hopefully that entire week and during the entire holiday season as well.
Dr. Sasson, I feel like my stress levels are going down just from having this conversation because, I'm one of those people with a long list as well. And I feel like if we just keep it real and just focus on the main thing, which is taking advantage of this opportunity to come together, we'll be okay.
Yeah.
Here's another question coming to us from Jed. He wants to know, everyone's been talking about COVID, but what about the flu? Is that expected to be bad this winter?
I think that's such an important question. So we've spent so much time this last year and a half really focused on COVID-19. And I think, I cannot stress how important it is not only to get your COVID vaccine, but to make sure you're getting your flu shot as well. We've already started to see a decline in people getting flu shots because of a number of other reasons. And so get the flu shot, ideally a couple of weeks before you're going to go to your Thanksgiving holiday party. So that would be, very soon if possible. The other thing too is to think about what we are going to do for COVID-19 to keep us safe. It's also going to help us with a lot of our other respiratory borne viruses. So the flu, RSV, parainfluenza, even the common cold. Things that we know we do to keep ourselves safe from COVID are going to translate over. So, washing your hands all the time. If you can, wear a mask if you're indoors, especially in a crowded place, getting the windows open, getting that ventilation going. And then, probably the most important thing is setting ourselves up for success, right? So, the healthier we are at baseline, the more likely we will be able to withstand all of those different respiratory viruses that we're coming into contact with because we know the masks are off. We know people are congregating again. So the more we can set ourselves up to be healthy, the better we're going to be on the long term as well.
Absolutely. Here's a question from Pete in Macon, Georgia. And Pete wants to know, do you have any tips for those who can't gather with loved ones during the holidays to avoid loneliness?
Pete, that's such an important question. And I think, we have seen a huge rise in terms of people's isolation this last year, depression, addiction. I mean, there's been a lot of other consequences that are not just the physical side of what's happened during the COVID-19 pandemic. So, I think the first thing I would say is obviously we've gotten very good at being able to connect virtually as well. So if you have the option to be able to do that, especially let's say with like elderly grandparents who just don't feel comfortable maybe traveling this time of year, making sure that you schedule that time in for them so that they can feel like they're a part of it. Maybe you set them up at the dinner table. They could be a part of your dinner with you, or you schedule some time so that they can see the kids after dinner, for example. I think that's going to be one piece of it. Another piece of it too is that, if you are in a community, let's say you're in a neighborhood where there's folks that maybe are isolated or don't have family or friends, we have done this for many years. We've done Friendsgiving for many, many years because we've got family, and we've got family here, but a lot of our friends don't. And so just feeling comfortable saying, look, even if you don't feel comfortable coming to my house, maybe we can go for a walk or we can do something. So again, just reaching out and being cognizant of the fact that people are struggling right now. This has been a really difficult year and a half. And just being, I think open, friendly, and just feeling very empathic with folks, especially folks who are maybe struggling at this time of year during the holidays, and especially if they're by themselves.
So many great ideas, Doctor. I definitely want to take advantage of some of those ideas that you shared with us. And this is another area that you're an expert on, Doctor. We're talking about kiddos on this one. Roger wonders, our family gathering will include younger kids. I hear kids rarely get seriously ill from COVID. So, do they need the vaccine to gather safely with family?
So I cannot stress this enough. Yes, kids are not going to be as likely to get severely ill as, let's say, somebody who's got a very, very weak immune system or someone who's older or has multiple other health conditions. But we know that kids are getting sick. We also know that there are kids who are getting long COVID. We know that just exposing them to the virus can give them symptoms potentially that can last for much longer. So, the best defense, not just for COVID, but for the flu, for measles, mumps, rubella, all of the childhood vaccinations that we got as kids, we can now help prevent our kids from ever getting that specific disease and then having all of the long term consequences that go around with it. So, I got my 5 and 6 year old vaccinated. And we got our first dose. Our second dose is going to be at the end of November. And yes, it makes me feel much more comfortable, not only for them to be in public settings, to be in school, to be in daycare, but also just knowing that as a mom, I'm doing what I can to protect them.
Dr. Lily in Syracuse, New York asked this question. My loved one already had COVID. How long will they be protected from the virus? Is it true that natural immunity provides more protection than the vaccine?
So this is a really great question. And I think it's really important to go back to the science on this. So natural immunity basically is the idea that you have been exposed to COVID, you then get COVID and all the potential long-term consequences of that. And then your body makes its own antibodies to that virus and probably has some T and B cells, which are memory cells that can help with that immune response as well. Now, transition that to vaccine mediated immunity, which is also natural immunity as well. And it's in a different context. So we give you a vaccine that we know has been tested, is FDA approved in the setting of, let's say, Pfizer, or emergency use authorized for all the other vaccines. We give you that vaccine. It gives you a very small spike protein. So it shows you an inactivated portion of the virus and then lets your own body have its immune response to it. So we create our own antibodies to that spike protein. And the vaccine is gone in 4 to 6 weeks, but those antibodies that our body has created are the things that are going to be circulating around, helping us prevent getting COVID-19, or if we do, help us from being severely ill from it. So that is also natural immunity in many different ways. And I always want to stress that it's our own body's immune system that is now sort of primed and ready to go in a very methodical, standardized way with the vaccine. Now, if you compare that to somebody getting COVID-19 and then getting their own antibodies, yes, they will have antibodies, but we don't know how long those will last. We don't know how much of an antibody response they have. So about 1/3 of people will have zero antibodies. And we also don't know if that's going to necessarily protect them against the next variant. And so that's why it's always going to be our recommendation to take a very safe and effective vaccine to get your immunity and not put yourself at risk by getting COVID-19. But if you do get COVID-19 and have some level of antibodies, you are eligible to get the vaccine as soon as you are no longer contagious. So that's 10 days out, 14 days out, you can get the vaccine. And there's data to show that that is some of the strongest immunity that people can have, is the having had COVID-19 and then getting the vaccine after it as well. So again, I can't say how important it is to remember vaccines are safe. We know exactly kind of what the antibodies response that we're expecting your body to have, and it's a natural form of immunity as well.
Absolutely. Now, our last question is sadly a question that more people have this year than they did last year. We lost family members over the last year. How do we cope with sadness during the holidays?
I think unfortunately with the global death rate so high, and then knowing that we've lost more than 750,000 Americans here just in the U.S., it is likely that you will know somebody who has died of COVID-19. So, I think the first and foremost thing is to recognize that yes, that person is not there. To be aware of that and to be able to also have conversations with your family and your friends about the fact that you're missing this person and you're missing that they're not there. But then also feeling comfortable, having the opportunity to talk about that person, to talk about the good times, to remember all of the amazing things that they have done and all the amazing time that you have shared with them, and to be grateful. I mean, I think this holiday season is really a time that we have to be grateful for the time that we have been able to spend with our loved ones who've passed, and the time that we get to continue to spend with the loved ones that are around us and continue to be around us as well. So, I think it's a very challenging time for folks. Just know that there's a lot of resources, whether that's your family and your friends. If you have to go to the emergency department because you're sad or you're lonely or you don't feel like you are comfortable being at home, know that we are here to help you as healthcare professionals. And then know that there's a lot of resources out there, and that ultimately it's a difficult time of year for a lot of folks, and you're not by yourself.
Absolutely. Great advice, Doctor. Dr. Sasson, thank you so much for visiting with us today. It's always great to have you here with us. Always tons of fun. Now, this is what I wish for you. I hope that your holiday season is stress-free and joyful this year. Is there anything else you'd like to share with us before leaving us today?
No, those are great words. And I think just remembering to be grateful. And I'm very grateful for the opportunity to be here with you, Mercedes, and to be able to help hopefully spread some information to the community as well.
Absolutely. Thank you. We're grateful for you. That does it for our show today, friends. Make sure that you take care of yourselves and each other. And if you want something to catch up on over the holiday season, you can check out our previous episodes there on our YouTube playlist. Please make sure that you take care of yourselves and each other. And always remember, we're grateful for you. We'll see you next time.
Learn more about House Calls, Real Docs, Real Talk, and submit your questions at heart.org/housecalls.